Today, the greatest risk of global catastrophe doesn't look like this. Instead, it looks like this. If anything kills over 10 million people in the next few decades, it's most likely to be a highly infectious virus rather than a war.
China has more than 200 confirmed cases of coronavirus, it's called, which produces pneumonia-like symptoms.
About the deadly coronavirus officially hitting the U.S., here's what we know. A Washington state resident fell ill.
It traces right back to when patient 0 became sick.
Which one person's infecting another person, and then that has since grown to be this large epidemic that we see today.
Global tally of confirmed COVID-19 patients stands at over 1.83 million, with the death toll at over 113,000.
In 2015, Bill Gates gave the American people a warning about the next global catastrophe. His efforts, amongst other scientists and experts, were critical, especially since Americans have had a long history of rejecting public health requirements. Expert David Rossner, the co-director at the Center for the History of Ethics of Public Health at Columbia University, points out that in the American government's response to the 1831 cholera epidemic, the 1918 influenza epidemic, smallpox epidemic, and as well as the current COVID-19 crisis, there is a consistent underlying theme of how trust in government plays a role. He also claims that in each of these epidemics, everyone feels somehow either they're personally immune because they're living a moral life, or secondly, that they have no control over it, that it's something that's going to be decided by God. Americans have carried this individualistic mindset over to issues outside of pandemics, to smoking and seatbelts. Despite overwhelming evidence that something could kill you, a portion of the American public has often found a law intended for the safety of the entire population dually as an infringement on their rights. When it comes to mask wearing in this COVID-19 pandemic, can Americans move past their history of individualistic mentality and put the greater good of public safety ahead of their personal interests?
The most current and timely fight between safety versus freedom is the fight against COVID-19 guidelines and mandates. With the rise of the new and highly contagious coronavirus, multiple state governors are enacting mandates such as stay-at-home orders, restaurant and bar closures, social distancing guidelines, and, of course, mask mandates. However, with these mandates, which are designed to protect the health and safety of others, particularly at-risk groups such as the senior citizen community and those with pre-existing conditions, comes backlash from a small population of American citizens based on the claim that freedoms are being violated. Though many Americans are following mandates, there are still a number of Americans who are not covering their faces or taking necessary precautions for the sake of protecting others. Protests have broken out in states across the nation, and health officials have even reported receiving death threats as a result of enacting these mandates. Many stores have refused to allow customers in the door for not wearing a mask, and some workers have reported that some customers responded to this refusal by purposefully coughing in the worker's face. Just to reflect how some parts of the nation have a large population of anti-mask wearers, North Dakota, which was the leading state for coronavirus cases throughout October, also had the lowest percentage of their population wearing masks, with roughly only 45 to 49% masking up. As a result, North Dakota, like many other states throughout the pandemic, have had hospitals at full capacity, largely due to the lack of efforts to prevent the virus from spreading. America is founded on ideals related to personal freedom and individualistic concepts. However, this rally for individual freedoms and ignoring certain COVID guidelines is coming at a price, as the U.S. is leading the world in the most COVID-19 cases, and there are no signs of improvement, with record case numbers occurring throughout November as we approach the holiday season. As numbers soar and the vaccine is still being approved, health experts and government officials are struggling to find the best solution that will help decrease the virus's spread, but also prevent backlash in a largely individualist nation. Dr. Anthony Fauci, who has been the top infectious disease expert in the U.S. throughout the entire pandemic, believes that enacting a mask mandate on a federal level would be an important step to curbing this pandemic. However, he hesitates to make such a strong recommendation, stating that things that come from the national level down generally engender a bit of pushback from an already reluctant populace that doesn't like to be told what to do.
But fighting back on public health requirements that are beneficial for society as a whole is not new for us. Before face masks, Americans went to war against seatbelts. This was legitimately known as the epidemic on the highways. Even though motor vehicle-related fatalities skyrocketed, Americans cried that they would not be tied down to cars. They felt as though they should be in charge and the government should not have the power to tell them what to do. It didn't matter to Americans that between 1920 and 1960, the number of automobile-related deaths doubled. There was proven evidence that seatbelts saved lives, yet 65% of Americans in 1984 still opposed mandatory seatbelt laws. Seatbelts were coined ineffective, inconvenient, and uncomfortable. Sound familiar to the tune of anti-maskers of today? People argued that in America it was more important to preserve individual freedoms than to regulate them through legislation like seatbelt laws. It seems that little has changed, but now, according to a Gallup poll, there are only 20% of Americans who oppose mask wearing and social distancing, so there seems to be great improvement from a few decades ago. But this trend is nowhere near new for Americans. These Americans who resist public health requirements are not community people and value personal interests and have a sense of entitlement over the collective benefit of the nation. As a nation built on protest and fighting against oppressive systems, it seems to be ingrained in many that it is American to resist mandates. And even before Americans went to war against seatbelts, they went to war against masks, but that time against the deadly Spanish flu.
A century ago, the globe faced an almost identical fight between following the safety guidelines and public health mandates recommended by the CDC and the public freedoms that citizens struggled to maintain during a global pandemic such as the Spanish flu. Compared to the most recent disease, coronavirus, during the Spanish flu, public schools were told to shut down, people were advised to wear masks and steer clear from attending or holding large events. The common 1918 saying was wear a mask and save your life. Mask wearing is proven one of the easiest ways to slow down the spread of such deadly diseases, yet one of the most controversial. Why is that? Well, back in the day, newspapers were the main source that were able to publicize information to the public instead of news headlines. The newspapers constantly promoted mask wearing to all and even mass-printed instructions on how to correctly wear a mask. During both the Spanish flu pandemic and the coronavirus pandemic, there are citizens, especially in the United States, that continuously refuse or create public tension by not abiding by the public health guidelines. History reports that people who did not wear a mask during the Spanish flu pandemic would possibly face numerous consequences much more serious than you would think. People could face possible monetary fines, they could have their name published in the paper calling them a mask slacker, and the most serious of them all, they could face a good amount of time in prison. A common theme throughout these two pandemics is it is not just important to wear a mask to protect your own self, but ultimately to protect those around you. In a time where Spanish flu was prominent, there were around a total of 1.8 billion people in the world. Now, 100 years later, we have over 7 billion. This creates a much more densely populated area, causing diseases like these to spread rapidly. It is said that 500 million citizens globally contracted the virus, which was roughly a third of the population at the time. It is a collective problem when the healthy behaviors such as mask wearing and social distancing are not followed by the entire population, which is yet again why this pandemic a century later is struggling with these same exact issues. This creates overarching questions like, will the American people continue to prioritize their public freedoms over the health and safety of others? Will the pandemic like these continue to worsen due to the lack of rules followed? And will citizens ever see the importance of public health mandates in the future?
In order to prevent the next public health crisis and solve this one, a few things need to happen. We already have the necessary tools in science and technology. What we further need is a consistent government response, a trust in science, and a solid health response system cemented in place. Because it is embedded in Americans' DNA to disobey mandates, the collective-based ideology that wearing a mask to protect yourself and others must be reinforced often. By ingraining this slogan, or a similar one, in the mind of the American individual, this promotes a community-oriented spirit that will motivate more Americans to wear masks. It is also important to constantly remind America of the consequences of not wearing your mask and framing the 200,000 plus deaths as what needs to be fought against. This is what it takes for Americans to move past a history of individualistic mentality and put the greater good of public safety ahead of their personal interests. And please, wear a mask to stop the spread and protect yourself and your family every chance you get.